Hello, pharmacists and friends. Welcome to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen in to find out how pharmacists and pharmacy students like me can improve population health, health equity, and patient care through advocacy and education. My name is Elisa Perino, and I'm a final year pharmacy student at the University of Rhode Island, working with the Rhode Island Department of Health alongside my professor, Dr. Bratberg.
And I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research at the College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast by the hosts don't represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island. So today we're talking about opioid use disorder vaccines, or opioid vaccines. So just a brief reminder that the opioid crisis is a long-standing public health concern. Just in the year up to May 2023, there were over 112,000 deaths from drug overdose, with 4 out of 5 of each of these deaths involving illegal fentanyl, which is a potent opioid.
Yeah, and so today we're going to be talking about new potential solutions that are starting to make waves in the world of opioid use disorder treatment, and was recently discussed in the Washington Post article that was posted earlier on November 6th this year. So these are immunotherapy or anti-opioid vaccines. And so basically how these immunotherapies work is they aim to engage an individual's immune system. So much like when we get a flu vaccine, the vaccine stimulates the production of antibodies that then go and bind to the influenza viruses and prevent an infection. So these anti-opioid vaccines prompt the immune system to generate a specific anti-opioid antibodies, and then when the opioids enter the bloodstream, these antibodies then bind to the opioid molecules and prevent them from entering the brain, thus preventing them from having an effect.
Yeah, Elisa, that sounds quite exciting, and it's great that we're doing all the research in this area. Researchers are studying vaccines that target an array of opioid molecules, often associated with the consequences of opioid use disorder, including heroin, fentanyl, which we mentioned earlier, and even some prescription opioid drugs or medications, oxycodone and hydrocodone. So these kinds of immunotherapies are thought to have, or intended to have, the potential to reduce the incidence of opioid use disorder, or OUD, and its most severe consequence, which is opioid overdose, with a minimal risk of side effects when used in conjunction with existing life-saving pharmacologic treatments and or some behavioral therapies.
And that's an important distinction to make. So the potential benefit is really when used in conjunction with other treatments and therapies, and there are still limitations to the success of these vaccines. So if successful, these immunotherapies don't have the benefit of minimizing the craving or withdrawal, which is a massive drawback, as cravings and withdrawal are arguably some of the biggest hurdles for someone living with OUD and the hardest to overcome. Additional questions that we need to kind of ask are, will individuals have access to these vaccines? Will they be willing to get such immunotherapies, and will the cost be attainable as well?
Yeah, we've got a lot of other questions sort of related to that is when we talk about medications for opioid use disorder. We just watched a presentation today that these are not equitably accessible. Some data that just came out today, and that only 1 out of every 4 people with an OUD or with a substance use disorder is actually getting access to medication therapy. So we're still, these are still in development. They aren't even really being tested in humans. So we're still uncertain where they'll have the greatest benefit. And we hope that the research not only shows that they're effective, but also in humans, and not just in the lab or in animal studies, but where will they have the greatest benefit? So you have to realize, too, that even if people have opioid use disorder, if they get this vaccine, will they still be able to use opioids for severe pain? If they have, trauma from a car accident and they're on this opioid immunotherapy, they're still going to need opioids to relieve their pain. So that's something we really need to examine. And you mentioned the cost. The cost when we talk about medications is there a benefit to society? Is there a benefit to the community or the person? Are those benefits going to offset whatever the cost that will be? And as we see with other sort of newer therapies, will insurance cover it? If insurance doesn't cover it, you're cutting out a lot of folks who could benefit.
And some more questions to kind of look at. Will these therapies be accessible? Will they be more accessible than existing life-saving therapies like buprenorphine and methadone? And also, if these vaccines are intended to be used with these existing therapies, will they or could they add to any potential benefit?
Right. As maybe some of our listeners know, buprenorphine and methadone are opioids themselves, very successful in reducing overdose and treating opioid use disorder, extending life, and reducing deaths by up to 50% or over 50%. If these vaccines, if these immunotherapies target opioids, maybe those opioids don't work and their presumed efficacy is decreased. Of course, there's also disparities in access to healthcare, period, and most especially seen in access to therapies that are life-saving for opioid use disorder. So will these vaccines be accessible to those populations? Will they reduce the health disparities that we see in opioid use disorder? Who is meant to benefit from this? And let's make sure that when they're studied, that they're studied in the populations who can benefit the most. The other thing is, what are the long-term risks? We've studied these other therapies for decades. We know they're safe and effective. We don't know what the outcome of these immunotherapies are, how long they'll last. And then the other thing that is probably most concerning to me is when what we have today is we see a polydrug overdose crisis where most overdoses are seen where there's multiple substances present. We see this massive increase in deaths from opioids plus stimulants or stimulants themselves like methamphetamine or cocaine. Now, there are vaccines being developed for those substances as well, but if people have a vaccine against an opioid, will they just switch to stimulants? Or if they use a stimulant vaccine, will they use opioids? We've got to really study sort of going back to your initial question, Elisa, which is, will people want to get them? How will they benefit?
Yeah, so there's definitely some unanswered questions still, but the good news is we already have several harm reduction and treatment strategies that are available and we know are successful and work. Some of those include liberating methadone to be more accessible to people, sustain the access of all forms of naloxone, as well as expanding pharmacist-prescribed and administered medications for opioid use disorder.
Yeah, those are great treatments. And I think one thing that we've been talking about and have some past podcasts you could look in our history here is decriminalizing drug possession and use, or decriminalizing and increasing access to drug paraphernalia, which allows for community drug testing and checking. Many, many other things. Look through our catalog. And of course, you found us hopefully on the internet, on Spotify or on Amazon Music or on Apple Podcasts. You can also follow us on our socials at PharmD-Pub-Health. That's Pharm like pharmacist, PharmD Pub Health. On Instagram, connect with us on LinkedIn. You can see us on X or Twitter. Turn on post notifications so you never miss an episode. Smash that subscribe button on all your favorite places you get podcasts so you never miss an episode. Thanks so much.